Hi, I'm Dr. John Payne with Piedmont Reproductive Endocrinology and Infertility Group. I'm a board-certified reproductive endocrinologist and OBGYN physician. I would like to talk about moving from traditional IVF to donor egg IVF and other third-party reproduction options. Some women are unable to conceive a child of their own by using their own eggs or oocytes. The reasons vary, including premature menopause or premature ovarian failure, poor egg quality, known also as diminished ovarian reserve, or the inability to respond to ovarian stimulation in a prior IVF cycle attempt with their own eggs. Also, women that have undergone previous chemotherapy, have the absence of ovaries from birth, or other genetic issues might need donor egg IVF, as well as women that have had prior ovarian surgery to remove their ovaries, or even sometimes ovarian cystectomies to remove cysts such as endometriosis or dermoid cysts. In these situations, third-party reproduction or adoption are options that may be used. Third-party reproduction is the use of eggs, sperm, or embryos from a third party that have been donated for use. These will enable an infertile couple to potentially achieve a pregnancy and become parents. At PREG, we offer both donor egg recipient IVF and embryo donation with frozen embryo transfers, and if adoption is an option that you would like to choose, we can refer you to a lawyer with experience in third-party reproduction and adoption. Women of advancing reproductive age, especially over the age of 40, are the women that are most commonly in need of donor egg recipient IVF. And these women are able to overcome the age barrier associated with infertility and are able to build a family in this manner. Fertility unfortunately declines with the woman aging, and that is because they're born with a certain amount of eggs in their ovaries, and over their lifespan are constantly losing eggs, and so eventually they get to a low enough number where they no longer have regular menstrual cycles, and fertility has declined even well before that, and then eventually they enter into menopause. And this is unavoidable. And for every woman, the length of time that they have to be fertile can vary, and so there's no definite age at which you should feel safe that you could achieve a pregnancy. Donor egg IVF success rates are very good. In fact, at PREG, they approach 70% live birth rate for each cycle that is initiated. This compares much more favorably than the 10 or 15% live birth rate that might be available to a woman who is over 40 using her own eggs and trying IVF without the donor egg treatment. Again, the success rate with the donor eggs is because we're using eggs from young, healthy women, typically in their early 20s, and the fertility potential of those eggs is much greater, as well as the risk of miscarriage is lower because the eggs are younger. As women age, naturally their fertility declines, as well as their increased risk of miscarriage should they become pregnant increases. At PREG, our live birth rates have been 68% using the donor eggs over the past several years, and this is a much more cost-effective way for women with diminished ovarian reserve or inability to conceive with IVF using their own eggs to achieve their goal of starting a family. Requirements for IVF using donor eggs are fairly simple. We would like for the woman to be less than 50 years by the time we do her embryo transfer, and would ideally like to have a uterus that is normal without fibroids or polyps to give the best chances for implantation of the embryos when they are transferred. The decision to use donor eggs rather than one's own eggs can certainly be a difficult decision, and there's certainly much disappointment upon finding out that the woman can no longer use their own eggs to achieve their goal of starting their family. However, we at PREG can hold your hand step by step and can help you and provide resources such as counseling with a clinical psychologist if necessary to help deal with these many issues of using third-party reproduction. Next, I would like to talk about how you choose an egg donor or the matching process. Basically, there are two options for donor egg. The first and most common would be using an anonymous egg donor to provide the eggs. The other option would be using a known or directed donor who is typically a family member, younger sibling, or a close friend. For the anonymous egg donor and the known or directed donor, the same evaluation occurs, which includes extensive screening and testing as required by the FDA. For the anonymous donors, they certainly must be healthy, be at least 21 years old and not more than 32 years old. They provide a 3-generation family history, which a geneticist reviews. They undergo a clinical psychologist evaluation. Sexually transmitted disease testing is performed per the FDA guidelines, a urine drug screen, as well as some genetic screening such as cystic fibrosis or other tests which are required based on the egg donor's ethnicity. Again, known donors must undergo the same evaluation process. At PREG, we have pre-screened our anonymous donors and usually have a pool of around 15 egg donors that are available at any time to undergo an egg donation cycle. This is a bonus because women that are ready to undergo the donor egg IVF don't have to wait a long time to undergo matching, and once they decide which donor they would like, the screening has already been done, so there's a lower chance of any surprises in the testing which would make a donor ineligible to donate their eggs. The matching process, once the woman has decided to use donor eggs, is reviewing the donor egg profiles and determining which donor they feel would meet their needs the most. They're able to review parts of the history and physical traits and parts of the psychological evaluation without giving any identifying data. This allows the recipient to make a good informed decision of which donor they feel would best meet their needs. The recipients and donors are then matched and using the list of specific requirements that the recipient would like in the donor, such as physical attributes, education, or ethnicity. The recipient for the egg donor IVF undergoes an evaluation including a few hormonal lab tests, the uterine evaluation similar to the IVF uterine evaluation, which involves a mock transfer, passing a catheter through the cervix into the uterus to confirm that the embryos could be placed within the uterus, and viewing the uterus with the ultrasound and saline to ensure there are no polyps or fibroids within the uterus that would cause difficulty with implantation of the embryos. The male partner would undergo a semen analysis to confirm that there is sperm present, which could be used to inseminate the eggs from the donor on the day that they are retrieved. Donor sperm may also be used with donor eggs. If a recipient for the egg donor is 43 or older, we also ask that they undergo a physical exam with their primary care physician, such as a family practitioner or internist, and an electrocardiogram heart tracing to ensure that the heart seems to be normal as well, and then their primary care would write a letter of medical clearance for pregnancy, which would be provided to PREG prior to undergoing their cycle. Once the donor matching has occurred, the next part is the actual IVF cycle. In order to do this, it requires synchronization of both the egg donor and the recipient. This is typically done by starting oral contraceptive pills when each woman starts their menstrual cycle, and both women are then synchronized with their ovaries in a state of suppression by the birth control pills. At that point, we can begin simultaneous stimulation of the egg donor, much in a similar fashion as we do for our regular IVF cycles, with the gonadotropin injections once or twice a day for approximately 10 days, and the follicle monitoring and blood tests to confirm the ovarian stimulation is appropriate, while at the same time the recipient will undergo an evaluation to prime the uterus to be receptive to the embryos. This is done by an injection once a day called Lupron, as well as estrogen patches that you place on your abdomen, changing them every other day, while the estrogen level will allow the uterine lining to grow. Once the lining is at the appropriate thickness and the egg donor is ready to have the eggs harvested, the egg retrieval will occur. Very similar to IVF, the eggs are obtained from the transvaginal ultrasound after IV sedation has been achieved, and the egg donor is very comfortable through the process. And once the eggs have been retrieved, the egg donor's portion of the IVF cycle is then complete. On that day, the sperm will be obtained to be used later for standard insemination or ICSI, depending on the needs of that patient. And the next day, fertilization results will be given to the donor egg recipient. On the day after the egg retrieval, the recipient will also add progesterone to her hormonal medications, which will allow the endometrium to be in the same phase and in sync with the development of the embryos. Approximately 3 to 5 days after the egg retrieval, the embryo transfer will occur, and that will occur in our IVF lab. The egg recipient will come in with a full bladder. We will use abdominal ultrasound guidance to help observe the transfer catheter with usually 2 embryos pass through the cervical canal up into the upper portion of the uterine cavity, and the embryos will be released and will hopefully within several days hatch and implant, and approximately 12 days later we'll be able to check a pregnancy test using blood and confirm that pregnancy was achieved, and we will then monitor those HCG pregnancy levels over approximately 2 weeks to confirm early pregnancy progression, and then an ultrasound will be performed approximately 4.5 weeks after the egg retrieval to confirm pregnancy has occurred within the uterus and that it is viable, and that heartbeat or heartbeats, if the case may be, can be seen. Once the pregnancy has progressed safely to around 8 to 9 weeks, you will then be released to your OBGYN for continued OB care and hopefully a safe and uneventful pregnancy and delivery of a healthy child